Hi there. Welcome to the Haldeman Norfolk Diabetes Program Introduction to Diabetes video series. My name is Jamie Anderson. I'm a registered dietitian and certified diabetes educator. We have some great content to share with you, and we'll be dividing it up into 3 short videos. This video is part 3, monitoring blood sugars and medications. Let's get started. Testing your blood sugars at home is a great way to evaluate your diabetes control. It also provides valuable feedback on changes to diet, exercise, and medication. The frequency and pattern of blood sugar testing varies depending on your blood sugar control, diabetes medication or insulin, and during times of increased stress or illness. Your diabetes care team can provide you with personalized recommendations for the frequency and pattern of blood sugar testing. Blood sugar targets can also vary, but in general, the goal is to keep your A1C or 3-month blood sugar average at 7% or below, your fasting blood sugar results before meals between 4 and 7, and 2-hour after meal results between 5 and 10. Now let's talk a little bit about hypoglycemia or low blood sugars. Low blood sugar is classified as anything below 4. It is often, but not always, accompanied by signs and symptoms such as feeling shaky, sweaty, dizzy, weak, or nauseous. Low blood sugars can occur if you skip meals or eat less carbohydrate than usual, you're more active than normal, you take more medication than planned or needed, or if you drink alcohol. If you suspect that you are experiencing a low blood sugar, it is important to test your blood sugar. If the result is less than 4, you should treat the low blood sugar with 15 grams of fast-acting sugar. Examples of this might be 2/3 of a cup of juice or regular pop, 1 tablespoon of honey or sugar dissolved in water, or 15 grams of glucose from a glucose tablets. Once you have treated, you will need to wait for 15 minutes before testing your blood sugars again. If your blood sugars are still below 4, you will need to repeat with another 15 grams of fast-acting sugar. Once your blood sugars are back above 4, you should follow up with a meal or a snack that contains carbohydrate and protein within 1 hour. Talk to your diabetes care team if you are experiencing frequent hypoglycemia. Now let's talk about high blood sugars. High blood sugars usually happen gradually over time. Signs of high blood sugars can include frequent urination and excessive thirst, having very low energy, blurry vision, numb or tingling hands and feet, and unexpected weight loss. While high blood sugars are often not a life-threatening emergency in the moment, the danger comes when we allow blood sugars to remain high over extended periods of time. This increases risk of damage to eyes, feet, heart, kidneys, nerves, and blood vessels. If you are experiencing frequent high blood sugars, we encourage you to speak to your diabetes care team, as this may be a sign that we need to adjust your meal plan, exercise routine, or medications. Let's finish up with a quick word on diabetes medications. As I mentioned in part 1 of this video series, there are many different issues or mechanisms in the body that contribute to the higher than normal blood sugar levels of diabetes. Because of this, there are also many different types of diabetes medications available that target these different issues and associated organs. Your diabetes care team can help you understand how each of your diabetes medications work and provide suggestions on which medications might be best suited for your particular situation. As a reminder, Diabetes Canada recommends the A, B, C, D, E's of staying healthy with diabetes to reduce the risk of complications of diabetes. These include A for A1C. Try to keep your A1C or 3-month blood sugar average at or below 7%. B for blood pressure control. Try to keep your blood pressure below 130/80. C for cholesterol. Try to keep your LDL or bad cholesterol below 2. D is for drugs that protect your heart and kidneys. Your doctor can prescribe these medications. E is for exercise and healthy eating, as we discussed in part 2 of this video series. S is for self-management. Set goals for yourself, identify barriers, and brainstorm solutions to overcome these challenges. S is for screening for complications of diabetes to keep your eyes, heart, kidneys, and feet healthy. And S is for smoking cessation. If you currently smoke, try to quit. Thanks so much for joining us for the third and final part of our Introduction to Diabetes video series. If you'd like more information on diabetes, contact information for the Haldeman Norfolk Diabetes Program can be found in the comments section below. Thanks again and take care.